All right, so I'm going to go ahead and get us started. Um, so, like I said, thank you so much for joining us today. My name is Dr. Leah Jeunnette. I'm the director of our Master's in Bioethics and Medical Humanities program here at Case Western Reserve University. We're going to be focusing today on student opportunities in clinical ethics as part of our master's program. And so I'm just delighted that you are here to join us. So, in addition to my role as the director of the master's program, I am also actually now I'm the associate director of educational programs and a senior research associate in our Department of Bioethics. Basically, all of my different roles involve me in administration, teaching, education, and I'm also a clinical ethicist at University Hospitals Cleveland Medical Center. So I am a part of our Center for Clinical Ethics, which is a joint center between Case Western Reserve Department of Bioethics and the clinical ethics team at university hospitals. And what that means is periodically I take turns being on call at the hospital, usually for a week at a time, every few weeks or so. And we get involved in patient cases. And we'll talk a little bit more about what clinical ethics is in more detail through this presentation. So we're going to first just briefly talk about Case Western Reserve and the School of Medicine. We'll then dive into clinical ethics. I have a discussion kind of to present. We'll talk about the master's program and clinical opportunities within it. We'll, at the very end, quickly review application process and deadlines, student assistantships and financial aid, and we will leave time for Q&A at the end. So speaking of Q&A, I want to mention that you can submit a question anytime during the presentation through the Q&A feature here on Zoom. I will save them till the end, but feel free to submit them at any point that you think of a question. So that being said, I'm going to turn us, as I mentioned, to just briefly talking about Case Western Reserve and the School of Medicine. So Case Western Reserve University, we are located in Cleveland, Ohio. We are an R01 research institution. And because of that, there's a lot of research going on, both in the School of Medicine, but also across the university and across the region. We partner a lot with our hospital institutions as well. You can see just some of the rankings that we have regarding our research portfolio and kind of the amazing work that's going on here. And that includes in bioethics. We have faculty who focus on research, and that could be doing their own research in the world of bioethics, or it could be involved in research and ethics as a part of a larger research study. So that being said, I want to pivot to kind of the main focus, which is clinical ethics. So one of the questions I often get is, what is clinical ethics? Not everyone has heard this before or is aware of this area of study within the larger bioethics and medical humanities context. So clinical ethics is ethics at the bedside, in a hospital, in a clinical setting, as it relates to patients, medical teams, families, and there's a lot of different things that come up. As you can see from this slide, there is a variety of things that we address, whether it's do not resuscitate orders, meaning code status of patients, advanced directives, like a patient having a living will or a healthcare power of attorney, decision making, who can make decisions, does the patient have capacity, and if they don't have capacity, who speaks on their behalf. Things like withdrawing or withholding artificial nutrition or hydration, or even things like respiration, ventilators, trachs. Topics of organ donation and transplantation. The conversation around non-beneficial treatment is pretty significant. So if a patient is very sick, has a very poor prognosis, perhaps even end of life, there often is a conversation of the treatment plan is no longer working. It is no longer beneficial to the patient. And in some cases, the treatment now has moved from being beneficial to being harmful. It's causing risk, pain, suffering. And what do we do in those situations? And so for a lot of these cases, ethics will be invited by the team to get involved. They want to get our recommendations on how to proceed, because ultimately, In majority of these cases, it's not that someone has done something wrong, although that can happen. It's pretty rare. Most of the time, it's simply that there is a conflict of values. And so what one person holds to be a value or a wish that they want for their own care may be different than someone else, or the physician on the team, or the bedside nurse, or the family member. And so working through those conflicts is a lot of what clinical ethics is about. So I want to give a great example. So the chair of our bioethics department is Dr. Mark Alicio. He has been working in bioethics for decades. He has a lot of great work that is available. You can read the cases he's written about, the things he's commented on over many years. And very famously, he wrote up this case called The Multi-Talented Motorcyclist. And you're welcome to go read about that. But I think what's great about this is it illustrates this value conflict. And as the case goes, imagine a man is in a motorcycle accident and he is brought to the emergency room. And in trying to stabilize him and trying to come up with a treatment plan, the team says to him, we need to fix your leg. And in order to fix your leg, we're going to have to take some tendons or ligaments, some things out of your wrist in order to save your leg. If we don't do this, we will have to amputate your leg. But as a result, your hand is going to have less function, right? You'll still have your hand, but its mobility will be restricted. And to the average person, that would sound agreeable. Save the leg, lose a little bit mobility in your hand. The value would be having all four of your limbs. However, in this case, the motorcyclist, the patient, is telling us, no, I would rather lose my leg and have full functionality of my hand. And to some, that may seem counterintuitive. It may seem confusing. And part of the case is that you start to ask the why. Why is he refusing this procedure? Why is he willing to lose his leg? And what we come to find out with this patient is that he is a classically trained concert pianist. And so having full functionality of his two wrists is incredibly important to him. It's more important than his leg. And so he is willing to have his leg amputated in order to have fully functioning wrists, hands, fingers, because of the career and the talent that he has. And using this example, it's a great illustration of seeing how values can conflict with each other. And it's not that one avenue is right and one is wrong, but it's simply a different way of thinking. And what I want to highlight is the take home is one, that within the world of bioethics and medical humanities, including clinical ethics, we have to consider complex value-laden issues. They emerge in the delivery and the practice of biomedicine and life science. Two, one way of defining bioethics and medical humanities is that the practice of working to identify, analyze, and resolve value conflicts or uncertainties that emerge in the areas above, right? So we think through these things. And then lastly, it is important to study various approaches to bioethics and medical humanities because each approach has the potential to offer different perspectives or surface a different aspect of the complex value-laden issue under consideration. So the idea is that we are viewing a situation through different lenses. If we had never asked the patient, why are you comfortable with your leg amputation? Why are you willing to give up your leg in order to save your wrist? Right? If we don't ask that, if we don't dig deeper, if we aren't identifying and analyzing and trying to resolve this, we would assume that he's making a poor choice, perhaps. But ultimately, by working through a case, we can see that there's various viewpoints. His values are different than perhaps others. Maybe he had someone in his life who already has a leg amputation, and he sees what a fulfilling life they have. And so to him, it's not losing a leg, but it's maintaining the talent he has for playing the piano, right? There's a lot of ways we can think about this, but ultimately we want to reflect the complex value-laden issues. We want to highlight those and we want to think through those as clinical ethicists and working through these cases. So moving on from there, one of the questions that often comes up is why study bioethics and medical humanities? You can see from my case example that, right, healthcare can impact us in different ways. In this case, we were talking about a specific patient and a medical team, but for some of us, it can be our personal area of study. It could be a professional, right, area of study. It could involve family and loved ones or our own health. But ultimately, constant advancements in medicine, science, technology can lead to big questions that are ethical concerns. The fact that we can amputate people's limbs in order to save their lives is a huge technology and advancement. The way that we do prosthetics now, right? But they lead to big ethical concerns. So questions like, should we intervene? Can we intervene? What if a patient objects to the to how we intervene? What kind of values should inform policy and practice? We're seeing this now a lot. Can we and should we ensure justice and respect for persons in research and clinical practice? There are many more other questions we can ask, but these are kind of some ones that come to mind, especially as they relate to clinical ethics and working with patients and families and medical teams in the clinical setting. So if we've now established that it's important to study these things, how does studying bioethics and medical humanities and ultimately clinical ethics assist a student's career path? And what we find in bioethics and medical humanities is it's incredibly interdisciplinary. So people that have the knowledge of bioethics and medical humanities come from different disciplines and different fields of study, and it helps to shape the current practice of the field. The other thing that it does is it helps launch students into their professional careers. We have students that go on to clinical professions such as physicians, nurses, PAs, NPs, psychologists, and many more. We have students who go on to legal professions like being a lawyer or a policymaker or a lobbyist, things like regulatory work or in the research space, arts and humanities, maybe becoming a bioethicist or an academic, and ultimately discernment for the undecided. We have students who come every year that have a very clear focus. This is what I want to do. I want to go down this path. This is my career goals. But we also have a mixture of students that are uncertain. They're looking for this concept of discernment. They know they want to be in healthcare or they know they want to be in law, but they like policy, they like health, they like this or that, and they're not sure how to put all these pieces together or what the education looks like to get them to the career of their choosing. And so this program has a way of allowing students that discernment, the opportunity to explore as they make their way in their career paths. So let's dive in a little bit more about the bachelor's program kind of at a high level, and then we're going to focus in on the clinical opportunities within the program. So this upcoming year, actually, my slide I need to update, we will actually be celebrating our 30th year this fall. It's very exciting. We're one of the oldest Masters in Bioethics programs in the country. Most students do our program full time. So in 1 year or 2 semesters, so they start in August, they graduate in May. We do have part-time options as well. Our curriculum is designed to be customizable. So around half of the 30 credits are considered our core courses. We'll talk about that in just a minute. And the rest are electives. As part of the curriculum, we also require a minimum of 80 hours of clinical ethics rotation, but most students do 160 hours. And we also offer short-term study abroad courses. These are 3-credit electives that students can take. They're fantastic opportunities to look at cultural comparisons and contrasts and different ways, additional lenses to think about for some of these issues. We have personalized advising for each student, and we also have dual degree options. So for those interested, please reach out. The dual degree does require you to apply and be accepted both independently and separately in order to be admitted to the dual degree program of your choice. So when it comes to our curriculum, I kind of like to highlight a little bit about it. So in this first column, you can see our traditional program. And by default, every student is in the traditional program. Every student, regardless if you're doing one of the concentrations or the traditional program, you will take Foundations in Bioethics and Medical Humanities 1. You will take your first semester of clinical ethics rotations, and we'll talk more detail about that. Then you will take 2 electives and a mini elective. Now, if you're interested in one of the concentrations, such as medicine, society, and culture, research ethics, or health policy, you can see where your electives might be designated to a specific course. So for medicine, society, and culture, and research ethics and regulations, you have a required course that fits into the elective 1 slot. You also have a mini elective for each of the concentrations. And then in the second semester, students will do Foundations in Bioethics and Medical Humanities 2. They will also complete a capstone paper. And then some students choose to do a second semester of rotations, while others will do a practicum as part of their concentration. And then we have our other electives. And in the case of health policy, there is a specific elective that you will be taking, a 3-credit elective to take in the spring semester. What's great is that our electives have a lot of variety to them. We have ones that focus in on specific topics like neuroethics, genetics and genomics, public health ethics, but we also have areas that focus more on medical humanities. So disability and society, aging, ageism and embodiment, death and dying in modern medicine. Lots of unique topics. We also allow students to take some electives outside of the department. So it could be topics like health law, or perhaps a history of medicine course. Those are quite commonly taken courses by students. So let's dive into clinical ethics opportunities. I think this is kind of the heart of what students are curious about. Now, this does not mean that students are necessarily going into a clinical profession, but we believe that it's important for students to be exposed to clinical ethics since it's such a significant part of the world of bioethics and medical humanities. So we have specific course opportunities. So one, as I mentioned on our previous slide, clinical ethics rotations course. This is 1 semester is required. Most students do complete 2 semesters. And we'll talk more detail about that in just a moment. We have another course called Beth 422, Clinical Ethics Theory and Practice. This course is taught by Dr. Mark Alicio, our chair, and he's also a clinical ethicist. As I mentioned, he has a lot of experience in this, and he really dives into the different topics in clinical ethics. What does it mean for a patient to have capacity? What does competency look like? What does it mean to have true informed consent? What does that process look like? How do we know if a patient understands risks and benefits? How do we know if a patient understands consequences of their actions? So we talk a lot about the theory. We also talk about the practice. So areas in particular, right? Pediatric ethics, reproductive ethics, right? Things that have areas within clinical ethics that we consider. And so we cover a lot of this end-of-life issues, medical mistakes or medical errors, and what does it look like as it relates to clinical ethics. You will learn from clinical ethicists in the classroom. So our partners at university hospitals, we have clinical faculty that work at University Hospital, but also teach in our program. Some of our faculty from our Department of Bioethics actually work at MetroHealth as a clinical ethicist or direct the Center for Biomedical Ethics. And then we also have colleagues at the VA and Cleveland Clinic who also will teach in our program. And it could be a whole class, it could be a handful of lectures, it could be through the clinical rotations. And so you'll have a lot of interaction with people doing ethics in the clinical setting. We have students that when it comes time to write their capstone paper, want to focus on a clinical ethics topic, and they are welcome to do so and work with a faculty reader that has a similar expertise. I have been a reader for students on capstone papers that have a clinical ethics component. So for instance, I had a student a couple of years ago who wanted to look at the intersection of ethics and legal when it came to discharging patients from a hospital to a skilled nursing home. And what did that look like? And why are the rules different state to state? And what does that mean for the ethics as it relates to the patients and the cases? So it's just one example. Lastly, there are research opportunities. So some of our clinical faculty, our clinical ethicists, are doing research in clinical ethics, and they're always looking for students to get involved. And so students will have the opportunity to join a research project. and do all kinds of work in that space as well. So let's dive into the clinical ethics rotations. I've kind of hinted at this quite a bit and mentioned it. Our clinical ethics rotations are kind of a staple part of our program. We are a program that is very proud of the way that we structure these. So students spend 80 hours in the fall semester, and they can do another 80 hours in the spring semester inside our teaching hospitals here in Cleveland. We have 4 teaching hospitals that we are affiliated with. Cleveland Clinic is probably the most well-known from the region, especially if you're outside of Cleveland. And University Hospital is another private hospital. So both Cleveland Clinic and UH are private hospitals. They do transplants, they do neurocare, cardiac care. University Hospitals has Rainbow Babies and Children's Hospital with it, and also a women's hospital. Cleveland Clinic does a lot of research at their institution as well. And so there's a lot of ways students can experience healthcare in those settings. We have MetroHealth, which is our county hospital. It is the safety net hospital of the region. So patients who are underinsured or uninsured will often go there to seek care. No patient is turned away from Metro. And then we have the Cleveland VA, our veterans hospital. The Cleveland VA hospital is actually the 4th largest veterans hospital in the country. So it's quite an extensive system here in Cleveland. Students that are interested in things like geriatric care, orthopedic care, spinal injury, mental health issues, the intersection between inpatient and outpatient care, you're going to get to see a lot of that through the Cleveland VA. So while students are rotating, they're going to be assigned to a particular hospital for that semester. So for instance, if you're assigned to MetroHealth, you'll get a list of rotation opportunities at the system. It's going to be a mixture of different types of rounds. So things like morning ICU rounds or general floor rounds, interdisciplinary rounds, or consult team rounds. And you will go with the team as they go visit their patients in their rounds. What's great is you're not only getting to hear the medicine from the physicians, the nurses, the PAs, but you're also getting to hear kind of, are there ethical issues that have been identified? And you as a student get to observe that, and you get to kind of piece apart, oh, for this patient, they're talking about this issue. I wonder if they've, the physician mentioned that the patient is in a coma. I wonder who's assisting the team with decision making if the patient can't speak for themselves, right? That's an ethical issue. Another area on the list could be committee meetings, so attending the ethics committee meeting, the institutional research board, rehab, animal research meeting, transplant selection meetings, and getting to hear how these committees make decisions that impact patient care. And then students also can go one-on-one with healthcare professionals. So this could be physicians, it could be nurses. We also include chaplains, social workers, genetic counselors, and you could be visiting patients, attending meetings, but you will have direct time with the healthcare professional as they understand ethics. So for instance, at Metro, students can go to the emergency room and shadow an attending physician. For an 8-hour shift. We often will pair you with like a Friday night shift, 11 p.m. to 7 a.m. Friday nights in an emergency room, level 1 trauma, are going to be incredibly busy. And so you're going to get to go with this physician as they're dealing with patients, as they're addressing traumas. And sometimes the ethical issues have to be addressed very quickly. There isn't even time to call the clinical ethicist on call. And so you'll get to see the healthcare professionals making these decisions quite quickly. And as I mentioned, students will be assigned to a specific hospital for the first semester. The goal would be to have one public experience, so either Metro or the VA. And then your second semester, you could do one private experience, either UH or Cleveland Clinic. In addition to the 80 hours in that given semester, you will attend what we call a weekly preceptor meeting. This is an opportunity for you and fellow students rotating at the site to also meet with a clinical ethicist and talk about the cases that you've seen. What questions do you have? What concerns do you have? What didn't you understand? Maybe you don't understand why the policy is the way it is, or how the legal and ethics intersect, or why the team didn't include a specific consult, or why haven't they called ethics? And so you get to work through those together in a group. You'll also keep track of your hours in a log, and you'll journal about your experiences, and you'll identify 2 cases in the semester to write an ethical analysis about. I will say students absolutely love these rotations. We get such good feedback from our students of what's working, of what's not working, of we need to make changes. But overall, students have an excellent experience doing these rotations. Students who are in particular looking to go onto clinical careers, whether it's physician or a PA or a nurse or whatever it might be, they in particular really appreciate being able to do 160 hours across 2 different hospital systems, and getting both depth and breadth of experience is important to them. And it helps to enhance their not only their knowledge and their skills, but their resumes and the applications that they might be submitting for other educational programs after they finish the master's. So some of the program outcomes that we see as it relates to clinical ethics, I mentioned it can add skills and knowledge, right? Being able to identify ethical issues in patient care can be really important, and it can help to address larger issues in a particular patient's case that maybe is going unaddressed in that moment. It does enhance resume and applications for different students and their career goals. For one example, the AAMC does recognize our master's program as an application enhancer for medical school. And so, the second example I will give is students who are interviewing for medical school while they're in their master's program often will share with us that they got to the interview, and yes, they asked them about their experience and why they want to be a doctor and those things, but they tend to focus a lot on the the clinical rotations during their master's program. They want to know more about the master's and studying bioethics and how it relates to being a future physician. Discernment is a great outcome from these clinical rotations. Students often will report to us that they realize that there's other careers in healthcare besides being a physician or a nurse. They didn't even realize that you could be a social worker in the healthcare setting, or what a chaplain does, or a genetic counselor. I am one of those who found who the program outcome was about discernment for me. So I did this master's program. I'm graduated in May of 2009. And because of this program, I understood and came to appreciate what the role of a clinical ethicist is in a hospital setting. And so I pivoted from one day hoping to be a physician to being a clinical ethicist or a bioethicist. And I ended up changing my career path because of this program. And we do see that with some students every year. And then lastly, we can network you with lots of alums from our program. Because we are entering our 30th year this fall, we have lots of alums. They are in a variety of fields and careers. And so many of our alums love talking to prospective students, current students, and making that connection. It's a wonderful thing to see. So if you're interested in applying to our program, there is an online application with an application fee. We do ask for transcripts for all undergrad and graduate institutions you've attended. Unofficial transcripts are absolutely fine for the application process. It does need to list a prospective graduation date on the transcript. And then once you would be admitted to the program, you would have to submit official transcripts, obviously. We do ask for your resume or a CV. 2 letters of recommendation. We ask that one of those letters come from some type of professor or instructor who can speak to your ability in the classroom setting. We ask for a statement of purpose. This is similar to a personal statement, but not exactly the same thing. What we're looking for is, what is your purpose for doing this master's program, for studying bioethics and medical humanities? And how do you hope to utilize it in your career path? Graduate test scores are optional. If you're an international student, there is some additional material that may be applicable to you regarding English language scores and transcript evaluations. And if you are a current student at CASE, meaning you're a CASE undergrad, you could apply to do this program as part of your senior year through the combined bachelor's and master's, and we would need to work together to do a PPOS form. If you are one of those students interested in this, please reach out to me. We can talk more specifically about the CBM program. For some students, we do get questions about financial aid. The biggest thing we get asked for is our student assistantship opportunities. So this is an opportunity to get involved in either teaching, research, or administrative roles within the department. Typically, the student assistantship application launches in January, and anyone who has submitted a master's application is eligible to apply. I will say these are highly competitive. We consider both need and merit for our student assistantships. And on average, students get around $6,000 to cover tuition. So it's a tuition fee waiver that you would receive, partial tuition waiver. And so that would be applied to both fall and spring semester. We do have our traditional financial aid office, filling out FAFSA, grants, loans, scholarships, work study. And more details can be found through the financial aid office and through graduate studies regarding tuition. In terms of our timeline, we are currently taking master's applications. Our next deadline is on May 15th. We'll call this our priority 2 deadline. If you are interested in applying for the student assistantships, you need to submit your master's application by May 15th. And then the student assistantship application would be due on June 1st. Our final deadline, if you're going to start with us in fall of 25, is August 1st. And we would have orientation at the end of August, and we start the fall semester on August 25th. So I see that we have some questions submitted, so I will go ahead and dive into these. I know we're just at time right now. So there's a question, what does a practicum consist of for those tracks of the degree? Great question. So for students who do the research ethics or the health policy concentrations, practicums are more project-based. So they're still doing 80 hours, but it's going to be specifically on a project. So for instance, we have a student who is doing the Medicine, Society, and Culture practicum, which is optional, versus research ethics and health policy practicum is required. As part of her MSc practicum, she's actually working with someone at the Natural Science History Museum here in Cleveland, and they're working on creating a health humanities display. And so she's working on curating that and doing a lot of research. We have another student who is doing a health policy and is also interested in research ethics. And so she is working with an IRB to update some documentation and create some additional information and documentation for the IRB. So there's a lot of ideas. What we focus on is asking students what within the concentration are you interested in, and then identifying an individual or a group to partner with for that practicum. So great question. Thank you so much. There's another question of how do you determine what hospital students get paired with, or is it randomized? Great question. So when it comes to the clinical ethics rotations, we do a little bit of matching and random assignment. So there is a Google form that students will be sent before the semester begins that they will fill out. There's a series of questions that will be asked. Things like, what area of bioethics, medical humanities, or just medicine or healthcare in general are you interested in? So if a student is super passionate about pediatrics, I'm probably not going to assign them to the VA unless there's a good reason. We ask students what hospital is their number one pick, both from the private list and the public list. We list the preceptor times, right? Are you able to attend the preceptor time? So if Metro is your number one pick, but the preceptor meeting conflicts with a class time, then we're not going to assign you to Metro that semester. So there's a little bit of matching, but also of matching interest, but also making sure it works with your schedule. We also ask about things like, do you have a car? If you don't have a car, we're not going to send you to Metro because that does require a drive to get there. So great question. And like I said, we work together to identify the assignment. All right, so let's see. I've got another question. I'm curious about the MSW, so the Master of Social Work dual degree, and how, if at all, the clinical rotations overlap with the MSW field requirements. This is a great question. So we treat them separately. So students who are in the MSW dual degree program with us are still required to do their clinical ethics rotations because they are going to have more clinical experience because of the MSW requirements, we do reduce the number of hours that students have to complete. So instead of 80, they would, for that semester, they would only be required to do 60. But students are still doing their clinical rotations and they're still doing the field requirements, and they're usually done separately in terms of where they're assigned and kind of their interest. If you want to talk about more about that, let me know, and we can go into more detail one-on-one. All right, so I see another question for incoming freshmen who are interested in dual degree path. What are there any summer courses at Case that we would consider this summer that would be helpful if you're interested in bioethics? Oh, this is a great question. So I would say if you are an incoming freshman or first year at Case Western Reserve, and you're thinking about our combined bachelor's and master's program, I would say one of the things we think is most important is for you to actually focus on the field that you want to study, what your major and minors will be during the years that you are exclusively focusing on your bachelor's degree. Yes, we have undergrad courses you can take, and if you want to do those and even do our minor, that's great. We love it. But don't feel that you have to have bioethics and medical humanities in order to be competitive to apply to our program. And we say that because we know that students come from all different universities and their access to bioethics and medical humanities courses varies. And so we don't have prereqs that are required. And so students that are considering doing the combined bachelor's and master's, we want to make sure that they are getting the most out of their time during their bachelor's. And so then when they start taking master's courses, they really can focus in on the bioethics and medical humanities. So I hope that answers your question. If you have more about the combined bachelor's and master's, please let me know. And then I see we have one more question. It's another great one. If offered acceptance, do you have or provide resources for students to help find housing if they are not from Cleveland? This is another fantastic question. We absolutely have great resources to help with identifying housing. Case Western Reserve, as with most universities, do not have graduate housing, and so students do need to find housing for themselves. We have documents that we can provide that help explain kind of where we're located on campus and where apartments are nearby. And we are on south side of campus, and so we encourage students to probably live closer to south side. Obviously, we have students who live on the north side as well. It's not that far away. But we also can refer you to, we have an off-campus housing portal that students can look through. Things like sublets are posted there. People talk about landlords that they've really liked or ones that they had trouble with, or students might even be selling furniture, right? And so looking for that, or looking for a roommate. And so there's that resource as well. The other thing I will highlight is we have a secret resource within our department, which is our graduate program coordinator, Marie Norris. She is very well versed in understanding the housing community around Case. And so she is a fantastic resource that we offer to students to talk to as well. These are great questions. I'm so thankful for them. We are a little over time, and so I want to respect everyone's time as they're watching this. If you have further questions, I would highly encourage you, email us bioethics@case.edu. I'm the person who's primarily checking this email. And if you want to schedule a Zoom one-on-one meeting, I'm happy to meet with you. We can talk about your specific circumstance, your interest in the program. How does this program customize for your circumstance? Talk about dual degree programs or the combined bachelor's and master's. Talk about housing. Any questions you have, happy to talk about this one-on-one with you. We will have additional webinars. We have previous webinars posted to our YouTube page. You're welcome to explore those. And if you want to schedule a visit to Cleveland and Case Western Reserve, let us know. Most of our courses that are going to be the busiest are on Tuesdays and Thursdays, but we do have students who come other days of the week as well. So I would encourage you to reach out to us. So I wanted to say thank you so much for joining us today. I'm glad that you were able to attend live or watch the recording. I hope this answered some questions and sparked your interest in applying to our Master's in Bioethics and Medical Humanities program at Case Western Reserve. Thank you so much for your time. And as I said before, please email us with any and all questions, bioethics@case.edu. Thank you so much, and I hope you have a good rest of your day.